No, mine has Lisa Tyler, ARNP.
Oh, okay.
Huh? I don't like this. If they can get it.
Should we need
Good morning, Supervisor Wickham.
Good morning. Happy November.
Absolutely.
Good morning.
Good morning, Supervisor Baker.
Good morning.
I don't see you.
Let me see what's going on here. I have my video turned on. Obviously you can hear me. Let me try this here. Okay. Is that better?
There you are. Good morning.
Good morning. All right. It is 10 o'clock. So we'll convene the Dubuque County Board of Supervisors meeting. This is the special COVID-19 meeting and other business. Monday, November 2nd, 2020, 10 a.m. And meeting is being conducted via Zoom, but also at the Dubuque County Courthouse, 4th floor Supervisors Chambers. And we'll go to the agenda. I was contacted by Patrice, and she has a conflict. She was hoping to join us later, so I will defer on her report. And I'm looking for Stacey Killian to see if she's on. Let me see if we can.
Hi, Dave. It's Stacey. Can you hear me?
Yes, we can, Stacey. If you'd like to start out with your report, and then later on we're going to get with Patrice.
That sounds good. Good morning, supervisors and everybody else. So
morning.
it's been a very, very busy weekend for us. As I'm sure you noted, we had some high numbers all weekend long. We did start our enhanced contact tracing middle of last week, and it was slow to start. For the first couple days, about 80% of people would not share any close contacts, which is really unfortunate. It has, looking at the notes from over the weekend, it looks like that has picked up quite a bit, and we're starting to get a lot more people to share some of their contacts with us so we can contact them and get them the public health guidance. Over the weekend, we spoke to over 640 individuals, both positive cases and then also close contacts. So I think this has made a big difference in the number of people that we can reach. So we were either able to speak with them or provide guidance to their close family members. So I think that we're starting to reach a little bit more than what we did, and that's helping. We're also continuing to work with the long-term care, and as you may have noted, we have a 4th long-term care center that is in outbreak status. Shady Rest Care Center in Cascade has 7 positive cases, and so they are in outbreak status. VNA is working with them daily, as well as Luther Manor, Sunnycrest, and also Mercy One. So far, we've had over 26,000 calls from the community through our public health call center. It's just continuing to go up each week, which is really a good thing as you see it. A lot of people are asking questions and wanting the guidance, so we like to see that. We're continuing to work with the schools and through the contact tracing, and thus far to date, we have contacted 1,383 families regarding either isolation, quarantine guidance, public health guidance, questions to the schools, a little bit of each. So we're continuing to meet with them daily, and then also providing routine contact to those that we don't formally meet with. So we're staying very, very busy with the schools. I think they're doing a wonderful job at trying to keep the schools as safe as possible and keep up with all the changing public health guidance. I know we receive a lot of questions from both the pre-K through 12 and then also the higher education. We meet with them every other week, and as a group, the incident command team does, and we've been going over, just any changes with public health guidance, looking at, I know some of the colleges have chose to go virtual once spring or once Thanksgiving break hits. And so we've talked a little bit about that. And they're just now starting to ask questions about what we feel second semester is going to look like, if we're going to be in the same situation we are in now, and how to safely come back after break. So we've been continuing on with that. VNA has submitted their provider agreements to administer the COVID vaccine. And so we will do that both here and then also in our Clayton County office. And I know Patrice and Mary Rose have been working very, very closely with a lot of the medical providers, pharmacies, long-term care facilities that are also applying for that. So once that vaccine is available, we are ready to go. As we mentioned, I think at the last Board of Health meeting, VNA is looking at hiring some temporary staff to keep up with the demand of calls and contact tracing, and then eventually also vaccine administration. So we are going to be posting for 2 temporary full-time nurses. They will be strictly COVID, so they'll do a lot of the contact tracing, and then they'll also, on the backside, once the vaccine's here, we'll give that as well. So I'm actually meeting to get that position posted today. So we've been staying extremely busy. Unfortunately, we're not seeing a decrease in the numbers, but we're keeping up just the same.
Okay, any questions for Stacey?
Good morning, Stacey. Ann McDonough. Thank you for all your hard work. You sound exhausted as well. So I appreciate you kicking back into the enhanced contact tracing mode. And, you know, many months ago, we decided as a board, and the Board of Health decided together with you that we would let contact tracing be done by the state of Iowa. And I'm wondering if that wasn't a mistake. How is your contact tracing different than that the state was performing? Do you know?
Sure. So with Iowa Department of Public Health, they do a traditional case investigation. So it's probably like a 4 or 5 page form. They find out when their symptoms started, have they seen a provider, who their provider is, who are the close contacts that they would have been close with from 2 days prior to the onset of symptoms and through the present. So they're asking a lot of the same questions, and then they're also then on the backside inputting that data into the state system. It's very, very time consuming. When we make our calls, what we're focusing on is making sure that A, they have a local contact, that they have someone here locally that they can call with questions or concerns. We're asking about their household contacts. We're checking to see who's in school or who's connected to the schools. We're asking whether or not they have close contacts that we can help them contact. And so we found at first, that first day, we weren't getting a lot of response, and I think it was maybe a little bit abrasive, so we kind of changed our tactic, saying, you know, have you been in contact with anyone from this time to this time? Can we help contact them and provide them that guidance? And we've seen a better response once we did that. And we've then been, you know, looking at, you know, their close families and friends and contacting them when we need to, and providing guidance not only to the positive case, but making sure that they have an understanding of the quarantine that their family and friends may need to be under as well. We've then also looking at employers and, you know, where are you employed? And then we can kind of watch for trends there. So it is very similar to what Iowa Department of Public Health is doing. I just feel that we may have a better response from our community if we were also providing a similar service. So we always end the call with Iowa Department of Public Health is going to follow up. They're going to have some similar questions from a state standpoint. Please make sure that, you know, you answer your phone and work with them as well, so they understand that they're going to get 2 calls. I feel like the response is going to be better coming from us, but completely taking it back from Iowa Department of Public Health would then bind us to all the documentation and their strict regulations, where now we can ask what we feel is needed, and we can just kind of be there for that positive case and their family and friends. And it gives us a little bit of negotiating room when we're working with individuals.
Right. And then would you know better then about community spread? I mean, now that you're going to actually get the contact information yourself, would it be likely you could share more information with
Yeah,
us
and that's what
talking
we're
about
hoping to be able
categories
to
of
do.
things. Mhm.
I think being able to see just how many contacts people are with when they get ill and how far is it going outside of the household, things like that. So I'm hoping it's going to give us more information to share. I know just roughly looking through our spreadsheets now, and this is just an estimate, but it's looking like about 3 to 5 contacts per positive case.
Right. A
It's
concern
kind of
that
an average that I'm seeing.
Sure. A concern that I have is a daycare, a daycare center where there was a notification of a positive case in a classroom of 12, 15 kiddos, and no contact tracing was done. I don't understand how that can occur. Should it?
So we can only go with what we're told when we talk to the positive case. So if they don't share, what they don't share, unfortunately, we don't know. And in some cases, it is unfortunate because I think there's times where things like that might occur and that we're just not aware of it, or maybe they didn't answer their phone or return our calls. We've seen that quite a bit too. I know the daycares have been working very closely as a facility with Kim Gonzalez, our child care nurse consultant, and they follow DHS's guidance, and they also have a state contact who gets involved whenever there's positive cases within the centers. And so I know they've worked pretty closely with the centers themselves. Without knowing the specifics on the family that might have been positive, I don't know if it was a case where they didn't answer or they didn't share, or we may not have had a good phone number for them. I mean, we see that a lot where we don't get the phone number, but it could be in those cases.
But wouldn't the daycare center have some obligation? I mean, they certainly know who was in that classroom.
Absolutely. In the cases that I've worked with, they've been very good at sharing with both Kim and Heidi Hotvet, who is the state representative for Healthy Child Care Iowa. So I don't know, without knowing the situation, why that didn't happen. But typically they work really closely with them and they follow DHS's guidance, and both Heidi and Kim help make sure that the center has that knowledge and everything they need in order to comply with that.
Well, we've had a big fail, so we might want to go back, and because I know that
Certainly.
personally, and just to readdress that again.
Sure.
And I just want to confirm, when you say you're working with the schools, you're working with all of the schools, right? The Western Dubuque Community School District, Cascade Schools, everybody.
Yep, every single school. We have a big manual that has all of the contacts for every single school in our county, and whenever I find a student or a faculty member at that school, then I'm in contact with those schools as soon as I know, and then they do the same thing for me.
So based on your work over the weekend, or anything you can tell us to date, what appears to be the trouble spot from the anecdotal contact tracing? Do you have anything you can share?
You know, I really haven't had an opportunity to dive into a lot of the notes. My staff have done a pretty good job at noting if there is anything significant of where they may have been exposed or to who. I know there's a lot of household spread. You can see that very simply in what we're seeing is typically you're finding full households are getting it, both husband and wife, and then potentially any children in the house. I'm not seeing anything jump out at me right now that's showing multiple employers of the same employer, anything like that. It truly looks like it's all over the place.
Okay. Very good. Thank you. That's all the
You
questions
bet.
I have for you, Stacey.
Stacy, this is,
Stacey?
yeah, go ahead, Jay.
Thank you. Stacey, this is Supervisor Wickham. I wonder if you would comment on just overall staffing levels that you're seeing at the VNA, overall morale. And then my question to you would be, is there any resources or assistance that the Board of Supervisors can provide you?
So thank you for your question. Yeah, staffing levels, we were struggling the last couple of weeks with staff illness, as well as probably almost every employer throughout the county. We're seeing some of the same things, but Staffing wise, we're getting back to being fully staffed. We've done, I think, a pretty good job at trying to keep inside exposures to a minimum so we don't end up with full staffing being out. All of our staff members have been trained on COVID, every single member, so that way they can help with the contact tracing. They've actually, all staff have helped when we did testing and things like that. So I think morale, it's getting tiring, I'm not gonna lie. I think we can't wait to see a light at the end of the tunnel and hopefully see a vaccine soon that will help slow things down here. I'm really careful at making sure that I'm not overtaxing one particular staff member or one particular discipline, such as our RNs, and we're providing support all the way around. So we've gotten a lot of support from the community, from the incident command team, and then from you guys as well. Your support financially has been beyond what we could imagine. So it's made things much easier for us to do the work that we need to do. The support of the Board of Health has been wonderful as well. I can't say enough good things. So at this time, I don't think there's anything that we need, but we do appreciate the support and you looking into that too.
Stacey, this
You
is
bet. Thank you.
This is Supervisor Baker. I was made aware that Johnson County has actually hired, I'm assuming on a temporary basis, college students who are in healthcare related course study, and they're paying them to help with contact tracing, and it seems like they're having success, and some of that might be because of the their knowledge, but also their age, that they're able to more like a peer-to-peer type questioning, and especially when you get to the younger folks. I guess I'd like to hear your thoughts on that. Is that something we would possibly be interested in? I know you talking about adding some temporary staff, but I'm asking if you're aware of this and if there's any interest there, if we want to reach out to the Johnson County to see how it's working for them. It sounded positive, but just kind of wanted to hear your thoughts.
Sure. It actually sounds very positive, and I think it would probably work well. I think you hit it on the head when you said the peer-to-peer. I think maybe having some of that, we tend to see higher numbers with especially that college age group, and so having someone closer to their age might help get a better response at our quarantine requests and isolation requests. We actually have a college intern here now, and she just got trained last week on COVID and is going to start helping us. And I have a meeting this afternoon at 12:30 to look at that option as well. So that's something that has crossed through my mind too, as a potential to assist us. And we might, I'm thinking, especially because many health students are not able to do their clinicals right now just due to safety and things like that, that they may have more of an opportunity to help in realms like this. So I definitely was thinking along the same lines as you, in hopes that that might be something that we can capitalize on as well.
Okay. Thank you, Stacey. Stacey, I'm gonna, I know that Diane Pape Freiburger, the vice chair of our Board of Health, would like to ask you a question. So if we can allow Diane Freiburger to ask her question, if we can get her unmuted.
Dave, this is Diane Pape Freiburger, and I am unmuted. Thank you very much.
You bet.
And thank you, Stacey, to you and your staff again for all the great work you are doing. You have been great partners for this. Just let the Board of Health also know if there's something you need, because we need you to continue to serve the community in the roles that you have, all of the roles that you have been doing for years. Thank you.
Thanks, Diane.
My question for you, Stacey, and this only you could probably give us the information on. I had asked the question last week at the Board of Health meeting related to the information provided back from the contact tracers from the state. But the question is related to the local contact tracing, and that is done through you, we have contracted. Are you seeing that there is this specific events or specific locations that potentially could be spreading positive cases? You know, is it potential that it's restaurants, bars, wedding events, funerals? Are you seeing any kind of a trend on that?
So that is something that we hope to see as we do more of this enhanced tracing. Just going through what I've received so far since I think we started this Thursday of last week, I'm not seeing a whole lot that's showing me any trends. But again, I really haven't had the opportunity to look real close because we had so many new, so much more information added in from the weekend. But I mean, just off the top of my head, I'm not seeing anything there, but I hope that we can, and that's one of the reasons why we're doing this, is so we can identify those pockets and trends so we can put forth our mitigation efforts to areas that we know need it. And so hopefully as we go forward, and I'll be able to watch this on a routine basis, and we can kind of move our efforts that way. But so far, nothing is jumping out yet as a trend, Diane.
Thank you.
Thank you, Stacey and Diane. Any other questions for Stacey Killian?
No.
Okay, all right. We will go to Tammy Freiburger for our report from Sunnycrest Manor, interim administrator, Tammy Freiburger.
Welcome everybody on this Monday. Want to give you an update on our isolation areas. In our isolation area level 1, which is our monitoring area by regulations where we need to put persons just to kind of keep an eye on for development of symptoms, we have 1. In our isolation 2 area, which would be our symptomatic, we're awaiting a test result, or we're awaiting confirmation of a questionable positive result on antigen, because we have had some false positives. We have 0 in that area. We do our routine testing of residents every Monday and Thursday, and we have our staff testing every Monday and Tuesday and every Thursday and Friday. This morning, I have become aware we do have 1 positive resident. After not having a resident positive since October 2nd, we now have 1 positive resident, and so our COVID unit is reopening. I will be helping them out a little bit, maybe not at the extent and level that I did prior, but following this meeting, we will be developing a plan for staffing that and everything. Just kind of an idea, last week in terms of our positive staff rate, we had positive 4 staff last week who were positive, and we do kind of do our own contact tracing as well here. And fortunately, last week, several of the people who had been positive had not actually been in the building. They had either been out, because they had quickly realized, that they weren't feeling the best and they were out, so they were not working with our residents, or they had been on maybe, had just some days off because of their routine schedules. And then we did have another staff positive this weekend on Sunday, yesterday. So we kind of look at where our staff works. Fortunate for us that we have a lot of staff working in consistent villages. And so we often make our determination on the types of tests that we do, because we actually have options, of the rapid test that we get results in 15 minutes. And then we have the PCR test that we can do. And so when we look at, our staff positive rate, and then we look at where they have worked, we kind of focus our efforts on testing. And so we have been pretty successful in catching them pretty quickly. So that's where we're at.
Okay, thank you, Tammy. Any questions for Tammy Freiburger?
Yes, Tammy, thank you. Thank you for all your work as our interim director too. I'm wondering about the staff positives. Any idea if those positives are from other jobs that they have? Do you see, is there anything that tells you why those are occurring in our staff members?
So we actually, interestingly enough, we have had, without outing anybody's privacy, we've had one individual whose parent had tested positive. Now, obviously, they were a high school student, and, just in conversing with them, they go to school, they're also on some extracurricular activities that they're involved in. And so I speculate, that one would be related, to possibly them and shared, with parents. So we also have had some significant others. So we have had, a positive staff. They're like, oh, I just became aware, my husband is having some symptoms and related to their, significant other being at their job. And so then they tested quite early, and then of course they ended up being positive. Also, another one was another significant other recently who had tested. The significant other had tested positive who works in a different nursing home. And then that staff came and said, I'm not having any symptoms, but I owe it to you to let you know. And they came in on their weekend off, in fact, so they were not working. They said, I want to let you know. And of course, we're like, well, we want to test you because we don't want you, we don't want you back at work. We want to take the safest route possible. And there have been, maybe one or two where we just, they're like, I just have no idea how this happened. So not necessarily events or other jobs, but directly linked to other family members I'm seeing. Or they know a friend, like they often become aware through their friends positive that, and then they let us know right away, like, oh my gosh, my friend tested positive. And we generally take the safer route, and we will have them rapid test, and then we will also send out PCR testing before we let them come back to work. So we kind of buy time, to determine before we let them come back to work. So I know that there's, different regulations for an essential caregiver, but we also reserve the right to take it a little bit safer, considering, the position that our facility has been in with an outbreak status and things like that, and knowing that we're the population that we're taking care of, that we reserve the right to be a little safer. So.
Thank you.
Mm-hmm.
I think you're on mute.
Yep, you were right. Thank you. Any other questions, Supervisor Wickham, for Tammy Freiburger?
None for me.
Okay. Thank you, Tammy, for your report. And I know you'll keep us posted with your daily updates.
Absolutely will.
Thank you.
Thank you.
All right, we'll move on the agenda. The next item up is the emergency management team update with our director of our emergency management services, Tom Berger.
Morning, supervisors. I just have a couple things to update on. The Homeland Security on Friday afternoon sent out the request now for the pediatric mask for the schools. So I'm working with the superintendents and the contacts there to get that order placed by Wednesday. And then hopefully next week we'll see them pediatric masks for the students for the schools that requested them. So that's going to happen. They weren't sure that that was going to happen or not. So we're happy that that's moving forward. And due to a couple outbreaks of the, in the long-term care facilities, we're getting a special shipment in today, which to get delivered out to a couple of the nursing homes of PPE. So we're still getting what they're requesting, or something close to it. They're getting synthetic gloves now instead of nitrile gloves, but we're working with them to hopefully get them through the outbreak. So with that, that's all I had to report, unless anybody has any questions.
None from me. Thank you, Tom.
None for me either.
Thank you.
Tom, Dave Baker, just looking for kind of an inventory update from the masks that we had purchased. I'm understanding we put a pretty good dent in that. Can you give us an update on the what we have left in our inventory?
14. I believe we have 14,000 of them left, Dave, out there. We'll double check that and put it in chat.
Okay, thank you. All right, anything else for Tom Berger? All right, thanks, Tom. All right, next up will be a testing update. And with that, we'll go to Ed Raber for his report.
Thank you, Chair Baker. This is Ed Raber. I don't have very much to add to the discussion. Testing continues, as I think has been noted. Long-term care facilities are testing with an antigen machine at their own location. So there's a lot of testing going on there, as you just heard, even from Sunnycrest. That's happening at the other 9 long-term care facilities as well, as my understanding is. Been fortunate to have an opportunity on a weekly basis to touch base with the new Test Iowa Clinic at Grand River Medical. Appreciate them making time to do that. They continue to have success. They feel like they're at a comfortable level of testing at their site in town that has, I don't know, up to 150 a day. They're also trying to carve out some other niches to make it convenient for the population. So they're testing into the evening, up to 7 o'clock at night, so that the public has a number of different options on when they can go and get a free test at one of the 2 Test Iowa sites, as well as from their own medical clinic or other outlets. So testing on the state's coronavirus dashboard continues to show Dubuque County being pretty heavy with testing and pretty for this last month, since we've had the second Test Iowa Clinic open, very consistent 400 to 500 tests a day. So that's a lot for a county our size. And we continue to have out of that a fairly high positivity rate. So that's where we are with testing.
Okay, thanks, Ed. I have a question from chat. Don't know if you can answer it or if someone from the Board of Health or Stacey Killian can jump in. It's what is the false negative rate on the nursing room, which I assume would be nursing home, antigen tests, and
Right.
are these rapid tests?
I am not an expert in that. So Lisa, I'm not going to be able to be your expert on this. The Iowa Department of Public Health has supplied nursing homes, long-term care facilities around the state with an antigen rapid testing machine. And so that is what they're using. I don't know if Tammy Freiburger is still on this call. She's the one actually using it that we have access to in these meetings. I would say that they, you heard her in her report talk about, when they get a positive, they scrutinize that and look back at that. They, just to make sure, your question was about false negatives, people that may test negative but actually be positive. My understanding, as these tests are have their own characteristics separate from the PCR tests that we're more familiar with in the rest of the community, they continue to try to monitor that. And I think you heard Tammy talk about how they routinely go out and get people also to test with a PCR test. So they're not doing very much at that at any of the long-term care facilities. However, those individuals working there routinely can take advantage of the Test Iowa clinics to get a PCR test. So I've written that down. Maybe that's something that we're probably not going to have an answer for you today, but maybe we can try to flesh that out for a future report. Is that okay, Lisa? You're muted. That's just
Yeah,
fine.
yeah, thank you. I appreciate that.
I'll even drop my phone number in the chat here for you. Okay, Lisa.
Okay. Thank you.
All right, and Tammy Freiburger is still on. Ed, I don't know, Tammy, if you have anything else to offer in regard to that question.
So the one thing that I do want to say is we have been using the BD Veriter, and it is a rapid test system. And I want to say that it has been very useful and helpful in us catching people quickly. And the way it works, and for lack of better words to put it, it kind of looks like a pregnancy test, the little, strip that we have here. And if we see 2 lines come up, so we have to wait 15 minutes when we, get our specimen and we do a little dip, in the vial. And then we put it onto the testing thing that looks like a pregnancy test. We need to wait 15 minutes before we put it into a machine for it to read. When our tests have been showing 2 lines, so there's 1 line that's always going to show up. So our false positives have come from, and I can speak to, and I can try to keep track of it better for you as well. We have had one resident who has, when we put it into the machine, they've only had 1 line, put it into the machine, but the machine read it, it said COVID positive. So we have had one resident who has tested that way twice, and then we automatically do the PCR. Anytime we have a positive, either staff or resident, and we do that through the state hygienic lab, and we do it automatically. They don't have to go anywhere. We do it right here. We are the same testers. We do that swab, send it out to the state hygienic lab. And for us to consider that a false positive reading, we have to have 2 tests greater than 24 hours apart for us to consider that to be a false positive. Now, we have had one resident that has happened to twice. We have done those 2 tests after they've never been symptomatic. The machine read it positive, only a 1-liner. And it ended up being that they were actually negative. Now, the flip side of using that machine, when we put the specimen on in that 15 minutes when we're waiting, we have 2 liners show up. And every single one of our tests on rapid testing that has shown up 2 liners has always read positive on the machine as well, and has always been positive on PCR. So we actually, whereas initially, when I first started this, I thought, oh my gosh, maybe the effectiveness or reliability might be less than a PCR, so to say, less specific. We have actually caught most of our positive cases by our rapid testing. They have tested with those 2 liners. They have tested positive on the machine, and every single one of them has tested positive on PCR, therefore verified. So I don't want to mislead anybody to say that, we're not trusting that machine. It's just there's a difference in the testing. And so when it's a 1-liner and the machine reads positive, then I have a question mark for myself. We treat them as they're positive. We automatically treat them as they're positive because we need to, and that's the safest action. We take it as a true positive, we're in an outbreak status. But we do that follow-up testing. So if that makes sense to everybody. So we are very thankful and appreciative. And I know that several nursing homes are, whether they're using the BD Veriter, there's also an Abbott card. So there's different rapid testing methods that can be used. So hopefully that makes sense to everybody as far as I have been very thankful for the rapid machines.
Okay, I'm going to chat, Tammy. I'm just going to read this again. This is from Lisa again. Concern is not the false positive tests. My concern is false negative tests because they give us a false sense of security. False negative tests will spread disease. And Diane Freiburger is in agreement with that. So is there, what do we have
And true, and last week we did, so we do have the option to do PCR. as well. And we certainly do always, we're evaluating our residents, we're doing our assessments, and anybody who is symptomatic, we are also testing as well. We did do a recent testing strategy where we did both. We actually did both. We did the rapid testing and we did the PCR based on where our staff were located. That week where we had our increased positive staff rating, we opted to do both to determine we wanted to catch on PCR and we wanted to catch on the rapid. But in between, at any given time that we have anybody with symptoms, we have also, that's when we utilize sending our people into isolation 2, that we put people, anybody presenting with symptoms, we put them into the isolation 2 for monitoring. We had one physician, if we can't come up, and I've contacted IDPH with regard to this, they ended up being, they had positive COVID recently back on 9/22. They presented with a new onset of symptoms after being clinically resolved, but we didn't have a reason. We didn't have a strep throat. We didn't have an influenza diagnosis. We didn't have any alternative diagnosis. So we placed them back into isolation for the 10 days. And that was according to doctor recommendation, IDPH regulation, et cetera. So it's tricky, and we try to base it, you know, today we look at all of our positives and then we try to base on which line of testing are we going to do, because the consideration for today was, should we just do all PCRs, you know, which might be a little bit more accurate, or do we do the rapid testing? And based on the fact that I had 3 people who had worked in our particular unit, I said, let's do the rapid testing to pick up any quick detection. And that is how we picked up our positive person today. Now, if we had done the alternate test today, the PCR test, we might have been waiting. Tomorrow, I would have probably gotten the test back as long as I had gotten that sent out early today. If I had gotten that sent out very early, because it takes a little bit of time to travel to get the test to the state hygienic lab. So I may have had that individual sitting in the room yet in that unit, COVID positive, possibly until tomorrow or later tomorrow night, versus I was able to today pick it up on rapid testing and they immediately were moved to the COVID unit. So it's we kind of evaluate it situation by situation based on how many staff we've had positive, where they're at, and we kind of look at the whole big picture and try to make a very good decision. And it's never perfect, because one test you're waiting a little bit longer for the results and one test you're getting it rapid. And so it's hard. It's hard. So, but I was able to say, you know, we picked the rapid test today, and based on where our positives were, and we picked up our positive resident today.
Thank you, Tammy. All right, any other questions? We're in the testing part of this. I think there's another comment regarding the false negative. Patrice Lambert is now on, and I think we'll let her address that. And if there's no other questions for Ed Raber or Tammy Freiburger about the testing update, I'm going to go back to the beginning, and Patrice Lambert is now available. And Patrice, we'd like to have you give your report, and also I'm sure that you're seeing the on chat the question about are there statistics available for false negatives and as opposed to false positives? So I'll turn it over to you, Patrice.
Sure, and I'm wondering if that's not for Tammy specific. Lisa, is that for Sunnycroft specific or statewide specific?
Can you hear me?
We can hear you.
Yeah.
Okay. So yeah, my point, what I was trying to get at was not the false positive rate, which other than causing some consequences of being quarantined and a lot of other things. My concern is the negative, the false negative rate, which I've seen a fair amount of, because that gives us a false sense of security. And so I think if we're using these machines, we have to have a statistic that says 20% of the time they're false negative, but they're really positive. I don't think we can be using a machine if we don't know what that statistic is. And so that was what I was asking. I'm less concerned about the false positives. I'm more concerned about the false negatives because those are the people that can spread. So my question was, do we have a statistic on what that false negative rate is?
Thank you. And Tammy, did you have to do like a quality assurance when you got your machine? Because I think that, I'm sorry, keep going.
We do. We have to do quality test checks before we use the machine with every testing session and document those. And we are also only able to do 3,500 tests on them. Once we reach 3,500 tests, we do need to get a new testing machine for that as well. It's hard for me to document. I think that the company would almost have to comment on that. I don't know that I have a statistic, nor I'm going to be able to show. I can only state that we've, continued to do the rapid testing. We've also intermixed it with the PCR testing, for our residents, that we've done a little bit of both that I think would probably pick up on. And our intent is to do the PCR testing at least once a week, is our plan. Today, I did veer off of that plan, and I'm glad that I did, because I wanted that, just based on the successful positives we've been catching with the machine. I wanted to do that today, and that is how we picked up our positive. But I completely understand what you mean by the false sense of security, which is why kind of within our facility, fortunately, I can comment that the person who tested positive has also not been out of their room. Plus their roommate had not been in their room with them at all for alternate circumstances. So, we have some strict activity procedures here where our residents are completely restricted. We're trying to keep them all in their rooms right now just because of the, the positive rates that we have been having. So, and we've been strict monitoring of the social distancing. Our residents are also wearing masks. So there's some additional things above and beyond, that we're needing to do as a facility to protect our residents. Staff is required to wear PPE at all times. I have to keep mine on because I'll tell you what, I felt naked. I went upstairs without my shield on one day, and I was horrified to think that I walked up out of my office without this on. So for me, it's just safest to keep it on. So we have a lot of other strategies in place to try to mitigate those risks with the false negatives and that false sense of security, if that makes sense. But I do know what you're saying, and the only thing I can do, is to keep track of the statistics as we test, and try to keep track of tests that match and PCRs and dates and times. And I have calendars all over the place and different colors for staff that are positive, different colors for residents, areas that they worked and things like that. But we're definitely taking it pretty seriously here at Sunnycrest, and keeping people as limited in their travels throughout our facility as possible. We keep our villages separate, residents in their room, we bring different activities to them, more individualized things. So definitely trying to mitigate the risks of any occurrences where there could be a false negative.
Thank you, Tammy. Patrice, let's go back to you for your report.
Okay, sure. And thanks, Tammy, as well. I appreciate you delaying our report. I did have another conflict, so thank you for rearranging the agenda that affected everyone else. So I'll just give you a quick update on the dashboard. With Dubuque right now, we've had 37,095 individuals tested. Out of that number, when I pulled the dashboard up this morning, it was at 5,828 individuals that tested positive. Out of that number, 3,719 recovered, and unfortunately 59 deaths in the state or in the county of Dubuque. And our Dubuque 14-day average positivity percentage is at 19.3. And we do have the 4 long-term care outbreak status identified still on the dashboard of being Luther Manor Communities, Mercy One Dyersville Senior Care, Sunnycrest, and then Shady Rest Care Center in Cascade, Iowa. Our percentages of our positive are pretty much basically staying the same. It's that younger, or that 18 to 40-year-old that consists of 44% of our positive cases, followed by our 41 to 60-year-old age group, which consists of 26% of those positive cases. And Sam does have a slide presentation ready to pull up, and we can go through that real quickly.
Trace, this is Ann. Can I ask you a question?
Sure, absolutely.
It would be helpful if we could know the breakout of the 18 to 25-year-olds.
Sure.
I know at one time that was being reported. I think it's mostly because I continue to ask that question. But is that possible for you to do that ongoing so we can get a better highlight of that age group? We do have obviously many institutions of higher education here, and I'd like to have a better idea what that looks like.
We can work on that, Ann. Sure.
You don't know what it is under the current situation, do you?
No, I do not. I apologize. Nope. So we can get that if at all possible, and we will send that out.
I wonder if that's
Sam and I can
Sam,
work on that.
Yeah, I was going to say maybe Sam could even work on that during this meeting.
That might take a little bit longer than this meeting, but we'll try and get on it this afternoon, and then we can send that out, Ann. Okay, so with the first slide presentation, and for some reason, mine just breaks up, so I can't really see the full thing, so I'm going to my presentation. Okay, again, we continue to be in the White House Task Force COVID report. The Dubuque County and the city of Dubuque remain in the red zone. And the following 3 counties still have the highest number of new cases over the last 3 weeks, that being Polk County, Dubuque County, and Woodbury County. And these 3 counties represent 21.9 of the new cases in Iowa. And then Sam, the next one. And with the White House report, and this one was on 10/25/2020, again, they give us the narrative and more or less recommendations. And some of those being all indicators of community spread are increasing, including the percent of the nursing homes with positive staff members and residents, and community spread is increasing hospital admissions, leading to potential resource constraints. Mitigation efforts must be increased to control community spread to include mask wearing, physical distancing, hand hygiene, and avoiding crowds in public, and specifically social gatherings in private. We are finding that as the weather cools, friends and families are moving social gatherings indoors, which again increases the spread. And the recommendation is to work with communities to limit large and small social gatherings. Current transmissions are linked to the home gathering. People must remember that seemingly unaffected family members and friends may be infected but asymptomatic. When meeting with people who are not part of one household, masking and physical distancing must be observed at all times, especially when indoors. And then again, they're again focusing on the Polk, Dubuque, and Lynn County. And then Sam, the next slide shows our zip code data updates. And these are the total cases as of today, which we will have the breakdown here in just a couple of slides to show the distance or the difference of what it was from last week to this week. But these are the total cases. And then if you go to the next slide, Sam, these are the percent of the positive cases per zip code based on the population size. as of today. Okay, and then the next slide, Sam, is the comparison of the positive cases per zip code from last week to this week. We still had some of our smaller towns that had no change, or it was less than 5, so we could not show that data because we do still need to continue to follow the Iowa Department of Public Health guidelines. And then we do also, I should share too, we do send all of this information out after this meeting. So we do share this with our city clerks and our mayors, and I send it to the Board of Supervisors. The Board of Health, TH, receives it, so we do share this so people are aware of what the current statistics are. The next slide just shows the current testing options. I don't know if those were mentioned already this morning, but Epic Health and Grand River Medical Group continue to be the hosts for the Test Iowa. The incident management team does meet with these groups on a weekly basis to see if we can assist in any way. And other options are the Harding Drug, Hy-Vee, and then we also encourage people to seek out their own healthcare provider as well. But again, we continue to share. Please call first before you go in. And then the next slide, we just included some information on the vaccine update. There's common questions such as when will the COVID-19 vaccine be available? Iowa Department of Public Health still anticipates that the vaccine will first be available in the late fall of 2020. We continue to have weekly meetings with IDPH on the vaccine information, and the incident management team continues to work on our Dubuque County work plan with our healthcare providers also on a weekly basis. Will the COVID-19 vaccine be prioritized to certain groups? And right now, Iowa Department of Public Health is telling us due to the initial limited supplies of the vaccine, doses may be limited to certain priority groups such as healthcare workers, residents of long-term care and assisted living, and those who work in industries where social distancing is difficult. And then as more vaccines become available, these groups will broaden, so more people will be eligible to receive the vaccine. And again, this is beyond our control to prioritize. We will be receiving the directive for the vaccine for the certain groups via CDC to the IDPH to the local public health departments. Will enough COVID-19 vaccine be available for everyone who wants it? IDPH is telling us limited vaccines may be available this fall, but the COVID-19 vaccine supply is expected to increase substantially in 2021 and eventually be available for everyone who wants to receive it. And again, the incident management team is putting together a plan that if we were to set up a point of distribution in the county for people to come in to get that vaccination, we are putting together a plan just in case. But again, we'll be working closely with our healthcare providers, our hospitals, our long-term care facilities, our pharmacists. But just in case we need it, we will have a plan in place for our point of distribution. And then we did include what is the difference between the influenza, the flu, and COVID-19. Influenza and COVID-19 are both contagious respiratory illnesses, but they are caused by the different viruses. COVID-19 is caused by infection of the new coronavirus called SARS-CoV-2, and the flu is caused by the infection with the influenza viruses. Some of the symptoms of the flu and the COVID-19 are similar. It may be hard to tell the difference based on the symptoms alone. Testing may be needed to help confirm a diagnosis. And the flu and the COVID-19 share many characteristics, but there are some key differences between the two. So again, we continuously urge people to get that influenza vaccine. We do get a report on a weekly basis from IDPH with our statewide influenza outbreak. And currently, Iowa is still at a low level, but we know that that can change overnight. So again, we're just telling people, please, please get your influenza vaccination if you've not had it as of yet. And then the next slide, we continue to meet with our pre-K through 12 and our higher ed on a bi-weekly basis. And we've had numerous questions or concerns that come from them as well as other agencies. So what we do is we take those questions and the concerns and we do some basic information searching that we can then share with the public, because we know if these questions and concerns are occurring with one agency or one institution, then they're probably out in the public. And then with Sam's skill, Sam then goes ahead and develops posters, which we do have on our website and on our Facebook page. So the two that are the newest this week that we thought we would share is that some people were hearing populations say, well, if I catch COVID now and isolate for 10 days, then I'll be good again for the next 3 months. Looking at if maybe they would be in a winter sport, or if they were planning to do some type of a trip over the winter just to escape the snow or the Iowa weather itself. So with this poster, we're telling people right up front that is false. Thinking this way can not only put them into a risk, but it can put others at risk. And then we list the rationale why this is false. You do not know how you will react to the COVID-19 once you are sick. While it's less common for young adults to experience complications, that's not always the case. There's little evidence to show that someone's immune for a specific amount of time after getting the COVID-19. The time frame could be shorter than 3 months. The United States is now seeing cases of COVID reinfection. Assuming that you are safe from COVID should cause you to lower your guard and lack on following the mitigation strategies. This could cause you to unknowingly pass the COVID-19 to a family member, a teammate, a teacher, or a friend. And then we do the directive of what you can do. And again, that directive is to continue to follow the mitigation strategies that stop the spread of the COVID. Stay at home when you're feeling sick, wear a mask, wash your hands, avoid large gatherings or group events. And then the next poster that we have developed are some alternative ways for Thanksgiving 2020. Again, we are not encouraging large gatherings by any means, especially large gatherings inside now that the weather is starting to move everything inside. So just some alternative ways to celebrate Thanksgiving is to have a small dinner with only the people who live in your household. If the weather is nice, consider an outdoor cookout with family and close friends or neighbors while social distancing. Prepare a traditional family recipe for family and neighbors, especially those at a higher risk of severe illness from COVID-19, and then deliver them in a way that doesn't involve contact with others. Have a virtual dinner and share recipes with families and friends. Shop online or do curbside pickup rather than in-person shopping the day after Christmas or that next Monday, because we know in the past those were our busiest shopping days. And we're not encouraging you to not shop, but just use a different alternative for shopping this year. Watch sport events, parades, movies from home, and or host a virtual watch party. So again, we know that celebrations are very important to family members, but again, we want people to be safe. And then our last slide, again, Sam always includes some links of different testing options, Facebook page, and then some resources that are good for the public just in general. So that is the end of the presentation. So I'm just looking at the chat. I'm sorry. Okay. And when I had pulled off, I see one is saying that we now have 61 deaths. I prepared for this early this morning, so I did the dashboard of what I was seeing when I pulled it all up, knowing that the dashboard changes constantly. So Diane, Pape, Freiburger had shared that information. And then, why are positive tests not counted if personal data are not obtained? What would be the positivity rate if these were included? And I do not know how to answer that. I'll be quite honest. Only one positive, an individual is only counted once. So if they have a positive test 10 times, they are only counted once. And that's the Iowa Department of Public Health control. It is not a local control. And then Diane Pape said, rumored is that the COVID vaccine will be forced on everyone. Please clarify. And right now, the recommendation from the Iowa Department of Public Health is that it is not going to be mandated. So as I speak right now, it is not mandated. It will just be available for individuals. Okay, and then another one is, have you decided to do the total recover breakdown by the zip code again? That gave the best idea of what was actually happening in each. It is not in this presentation, but could you get that for us? That's something we've been asking for our readers. And yes, we just, in all honesty, have not had time to concentrate on some of these. So that was Ben. So Ben, we will see what we can do and share those of what we're able to share. So any other questions?
Okay. Any questions for Patrice Lambert? Supervisors Wickham or McDonough?
None for me.
None from me, thank you.
Okay. Thank you, Patrice.
Thank you.
All right. Next, we're going to go to our Board of Health update, and Chair Tom Beshen has notified us that he has a running conflict on Mondays, but we do have our very capable Vice Chair, Diane Pape Freiburger. And Diane, turn it over to you at this point.
Good morning, everyone. First, I need to note the great job that Samantha and Patrice have done to try and provide more data to all the communities in town. In addition to what they are already providing, is that Samantha also is doing a great job. I've been referring to her when I understand that there are special events throughout the county. I will refer this to Samantha, and she makes contacts with the event organizers to see if we can, from a county standpoint, from a health standpoint, offer some increased mitigation strategies and to find out what their mitigation strategies are in an effort to decrease the number of positive cases that could be spread at these potential events. And so if someone is aware of an event, the best thing would be to email Samantha at the County Health Department, and she can follow up on that with us. In addition to that, if more signage is needed, Samantha is very capable of getting that done for us. The Board of Health held a special meeting on October 27th to once again discuss a mandate, and this for wearing masks in the county, for the full county. We did this with the health of the community, with the concern, with that is our concern. That is what we have been directed by the appointments to the Board of Health to do. The resolution was unanimously approved. The resolution was revised to no longer require enforcement by business owners or employers. And at the end of my report here, I can read off what we changed that to. Moving forward, another public hearing and formal vote on the resolution will be required. We are scheduling that action in a special meeting to be held at 6 p.m. on Monday, November 9th, 2020. Notice of the public hearing will be published in the 3 county newspapers on Wednesday, November 4th. And the meeting agenda and packet will be released on the county website on Tuesday, November 3rd. The same process that was used for the previous public hearing will be again used. This will be a Zoom meeting, and in the publication, it will inform the public how they can participate and also where they can send their comments to. So that is put together in a packet for all of us to take a look at. And the verbiage that we changed, the requirement for the businesses in the new resolution is all businesses that are open to the public must post signs at the entrances informing customers of the requirement to wear face coverings while inside their business. Face coverings must be provided by the businesses for customers who do not have their own. We have made contact also to Tom Berger to inquire the number of cloth or the disposable face coverings that are available out of the 50,000 that were purchased by the county. And we had also been told the 14,000. We have also asked Tom Berger, which he did, the supplier of cloth face masks, how much they are if we purchase some, if we need to purchase some more to help those businesses to provide them to customers coming into their stores. And those are available at our request. We would, of course, have to approve the appropriations through COVID funds for the Board of Health if we needed to do that. Are there any comments on this?
Diane and McDonough, you're aware that we're providing thousands of masks to targeted areas inside the city of Dubuque, right?
Yes.
Mm-hmm. So, I mean, we're talking about if we're going to be supplying masks to every business, you know, I guess, I mean, whatever it's going to take, but the city of Dubuque is not providing any face masks inside the city of Dubuque. If you wish to have one, if you have a barrier to getting a face mask or a barrier to laundry, which our lowest income families do have that as a barrier, then you're directed to a fire station, or the police will give you one before they issue a citation, or the Jewel. So if you get on the bus, you can get a mask if you don't have one. But you know, just pointing that out to you, that that's a substantial lift to provide to every business in the county face mask. I mean, we're down to, I've just made a request for more face masks to go out. So I think we're down to about 7,000 or 8,000 in our county mass reserve, 8,000. And the only other thing I wanted just to mention is that Harrison County, which is on the west end of the state of Iowa, did pass a mask mandate on Thursday. I think it's a mask requirement. The duration is in 30-day intervals to see if the positivity rate can be lowered. And you know, you've gone forward with the mask mandate and you're having the public hearing and so forth. But that's something that certainly the mayors and I are in discussion about. You know, looking at a targeted positivity rate that everyone can agree upon based on metrics is something that they're keenly interested in, and also short duration. So just to, you know, let you know, you and I had a few text messages yesterday. There are other things being discussed at the same time that you're going forward with your, you know, your public hearing. So it's not as if it's all quiet out in the small communities. There are folks working on keeping citizens safe there as well. So, but I appreciate your update.
Dave, you're muted.
Okay, and I wanted to comment, Diane, again, has provided some masks, and we did get them out through the Dubuque Area Labor Harvest distribution network this weekend. And Diane, thank you for your efforts with that. And to Tom Townsend and all the volunteers from the Dubuque Area Labor Harvest, getting those out throughout the county, and to folks that need them. And as Ann said, people that may not be able to afford to buy a mask. And proud to be a part of the Dubuque Area Labor Harvest organization. But the real credit goes to Tom Townsend and the all the volunteers. So, okay.
Dave, this is Diane. I just want to make one comment on the distribution of those masks. Those were actually cloth masks. You know, these are not the disposable masks that are being provided out through the rest of the county. And that was by a volunteer that had sewed those, you know, after I had provided materials for her to do that. Preferably, it would be, you know, that we could use cloth masks. The problem is the volume of cloth masks that we might need, because cloth masks can be washed and reused. And then when we look at it from an environmental standpoint, it would be better if we were using cloth masks versus the disposable masks. But so as many individuals that will provide cloth masks, you know, I will continue to supply to people. But right now, I've given out all that, about 3,000 that this person has sewed for me. So, but thank you. I would just still encourage people to use a cloth mask versus a disposable if they can have access to them.
Right. And Diane, the thing with the disposable, you know, I too worry about the, you know, the environmental effects, and I've talked to Tom Berger about that as well. That you know, the reality is that the purpose of giving the disposable face masks out is that it's meeting the citizen where they are. It's at that time. It's something that is packaged and given to them. And I can appreciate someone has sewn you, you know, 3,000 masks, but you know, we have more than 6,000 disposable masks out in the community, and you know, there's many more thousands here at my home ready to go as well. So it really is about volume and removing a barrier. And what I'm hearing back from some targeted businesses is that it's changing people's perception and their approach to a face mask and wearing one, where it's not confrontational. It is that they appreciate being handed more than one, you know, it's a package of 3, to take one with and put one on immediately, do your shopping, make your pharmacy purchase, and then you have one maybe to take home and share or use for another time. So it's changing the tone. And as you and I know, working on the trying to encourage more and more people to wear a mask, that's how you can change behavior, is by changing it from point of confrontation to the willingness and the interest in complying and the interest in changing behavior. So I see it as being a positive on a couple different ways. And the face masks, there are still some cloth ones out, I've discovered, at some nonprofits. People do not care for the cloth ones that have strings to tie around their heads, or they're big or larger, they don't fit. So the disposable one seems to be the one that's met with the least amount of resistance at this time, just based on my, I don't know, what, 8 weeks maybe of doing this. So that's the reason to proceed with the disposables.
And thank you for that comment, Anne. And I believe we do need to meet people where they're at. With that, we also have to look at the health caution here with using the disposable masks. They're not meant to be used for 3 months, you know, so, or even 2 months, or even 1 month, especially.
The mask we're handing out isn't even gonna last more than the day you have it on because the strings pop. So, you know, nobody is gonna be using this mask for the week. It's really meeting them where they are and trying to change behavior. So there's a, you know, and as you and I know, we've talked about this, that there are parts of our community where people are sharing masks to get service. And we, you know, those are the behaviors that we also need to change rapidly. And so, you know, there are, folks may not be aware, but there's a nonprofit in downtown Dubuque that actually helps individuals with tokens for machine wash, for laundry issues. There was a hygiene giveaway last week at First Congregational Church, and one of the hot items was laundry pods for doing your laundry. So, you know, there are barriers to folks who don't have washer dryer in their house, and cloth masks become part of that unmet need. So the cloth works for many folks, but it seems to be more of a choice to be able to do that. But I think we're all together that whatever we hand out, it would be great, you know, to make sure that the behavior changes. That's the purpose, and that it becomes safe behavior and not just strict compliance, and someone doesn't hand a mask to each other to go into a store or a business.
Thank you, Ann. And I still do promote the cloth masks. And I know when we were handing out all those thousands from Dubuque Mattress, and I was doing the education to the individuals as they were coming to receive those, I commented to them, you don't need a wash machine, you know, because I didn't want that barrier. That can be hand washed in their sinks, hung over a hanger, because we were given multiples out so that we are able to, that while one is drying, they could have another one to wear. I think that the problem with that was the straps were out after even hand washing those. So, but thank you. And I believe that we've had good conversation on this, but thank you everyone for doing what you can to get the community safe. And I just, Dave, can I just make a note here? And, you know, Patrice did look at the dashboard earlier. For 4 days, the hospitalizations in Dubuque County were being listed as 33. When I looked right before this meeting, we're at 43. These are Dubuque County residents hospitalized. They are not the number of hospitalists in our hospitals. Just to clarify that again, we've gone through this before, but it is up. Dubuque County residents, there are 43 of them hospitalized as of the time of this meeting. Thank you.
Okay. Thank you, Diane. Do we have any other questions for Diane Freiburger from the Board of Health, our Vice Chair?
I do not.
And Diane, just a brief report on the mass distribution from Saturday. We had one specific case that my wife and I delivered to, and they had requested 3 children's masks. And while we were delivering, she handed them out to her children, and they were excited and couldn't wait to put the masks on. And so I think, you know, it might be a small victory, but you know, obviously there was a need there, and thank you again for your efforts. So, all right, any other questions? If not, then we would go to updates from Dubuque County municipalities. I know we have Mayor Sandy Gassman from Epworth. I don't know if Sandy has a report. I'm trying to see if there's any other mayors or city council folks.
Well, we might have a report, Chair Baker, from Ed Raber. He's kind of been charged with making those connections as well.
Yeah. I planned on going to Ed as well, but thank you. So I'll open it up then to Ed Raber, and if we make sure that Mayor Gassman has the ability to speak if she would like to. So Ed, I'll turn it over to you.
Thank you, Chair Baker. In the last week or so, we have had some correspondence with a couple different mayors. I have not I have not talked with Mayor Gassman from Epworth, but I would say that the mayors that we've that I've had an opportunity to discuss our situation with continue to have to wrestle with how to move ahead. They've provided some feedback as they continue to look for trusted sources and in a way to quantify a goal that we could be working toward that would help they and their citizens in their communities or surrounding communities to better get a grip on where are we going. I think that they do understand that the number of active cases and the number of positive cases in Dubuque County has gone up at a pretty steep incline in the last month, 6 weeks, 4 to 6 weeks, and doesn't appear to be abating. So they continue to look for ways in which they can be engaged to help in their communities. We just recently helped them. Helped a community that has one particular point that has a lot of community interaction, and we help them with a way to provide some safety for the employees of that facility. So we're trying to be responsive and open to them when they communicate with us. But I would say that they continue to try to figure out, what is the information telling us? How does it relate to our community? And what does the state have to say about how we can work toward mitigation, so that trying to figure out a way to change those behaviors so that we get a decreasing rate of infection, a decreasing number of active cases.
Okay, thank you, Ed. Any questions for Ed Raber on the updates from Dubuque County Municipal?
No questions. No questions from me at all.
Okay, thank you for the report, Ed. And guess I'll take a moment and open it up to any of our mayors or city council folks from throughout the county. And okay.
I do know that there is a group of 5 very active and engaged mayors that meet pretty routinely, and I certainly have phone contact with a few of them on a weekly basis. So I know that the folks who don't want to hear this won't like the message, but getting through tomorrow as a day of hopefully there'll be resolution about a national leader will allow us to focus on the pandemic without there being as much perception of overtones. There are individuals, I think it's less now than it once was, who do feel that the media coverage and perhaps even our own focus on this is driven by political motivations. So, getting through the election tomorrow and hoping we get a clear resolution will bring this issue back to the forefront as well, as the mayors continue to work on the wellness in their own communities. They are not disengaged. There's lots of conversations about possible resolutions and formal action to be taken together. And so there's certainly conversation, and I do see that coming to, I think, a peak point here in terms of how much more can be done. But I've spoken to other counties, other supervisors in other areas. I know Ed's been talking to other directors of public health in other areas, trying to get resources pulled together. And there's other things scheduled for this week to bring discussion points with experts and mayors together. So continue to work on public health. So there's at least 5 that are actively engaged. And Sandy, of course, is one of them. And so I appreciate that no one has just drifted away. They're still they're looking for the more information that Patrice and Samantha can provide to them as points of data as they learn Domo will allow for swifter information out to the mayors as they try to make sense of the data that isn't in any way clear. So.
Dave, may I speak? This is Diane.
Of course, Diane.
You know, and I appreciate that those mayors, you know, are having this conversation and they're taking a look at mitigation strategies. And I appreciate that tomorrow is an election. But reality is, no matter who is elected president and whether it's decided tomorrow or in a week from now, we need to take a look at what's happening in our community now. As a 9-member Board of Health, we unanimously have looked at this. The health of our community comes first. And that is why we felt it was necessary to again bring a mask resolution back to try and maybe decrease the numbers and to decrease the deaths, you know, that we've been having. But I appreciate that those conversations are happening across all of the spectrum from the top down. Thank you. Thanks for that input.
And Diane, I appreciate that your action to move this forward continues to keep it to the forefront. So, you know, that's helpful. So it doesn't seem like it's a side issue. But it's not the only thing being worked on, so.
Okay. All right, thank you. Is there anything else on the updates from Dubuque County municipalities? Okay, if not, we're going to go to next item is a resolution regarding appointment of deputies, assistants, and clerks. For that, we would go to Dawn Sherman, our Human Resources Director.
Good morning, Chair Baker. Yes, you have 2 positions at Sunnycrest. We like to keep them staffed as quickly as possible. So I'm recommending approval for these placements.
I'll make a motion to approve the resolution.
Second.
Motion made and seconded to approve the resolution, and it's regarding 2 Sunnycrest Manor permanent part-time positions, food service worker and program instructor. Any further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0.
Thank you.
Okay, you bet. And next item on the agenda is notice to bidders. And this is the 3-year Microsoft Enterprise Agreement. I am assuming we'll go to Nathan Gilmore for some input on this.
Good morning, everyone. So in December of 2014, we did the first enterprise agreement with Microsoft for all the various licensing that the county uses. It encompasses server licenses, SQL, email, Microsoft Office, Visio. There's a lot of parts in there, but the enterprise agreement is the most efficient and easiest way to track it and most cost-effective way to do that. We did the first one in December of 14. We did it again in December of 17, and hard to believe it's 3 years later, and it's time to do another one. This should go out to bid. It's sometimes we get 1 bid, sometimes we get 2 bids, but we'll see.
Nathan, I'm aware you gave us a budget recommendation as well when we talked about this during a previous work session. So I'm prepared to make a motion to approve the request for bid.
And I will second that.
Motion made and seconded to approve the notice to bidders for the 3-year Microsoft Enterprise Agreement. Okay. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay, next we'll move into You're welcome, Nathan. Thank you. Public comments. And at this time, anyone may address the board on matters which are of concern to that person and which are not agenda items. Please go to the podium, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. All right. I'm chuckling at a comment on chat that apparently the dog had a comment. So, all right. You can notify us by chat or by raising your hand on Zoom if you have a comment on something that was not on today's agenda. Somebody can help me out. I'm not seeing anything.
You have Lisa Tyler who has raised her hand to speak.
Okay.
And she can unmute herself. I think she is.
Okay, Lisa.
So just to understand, I wanted to talk about the mask mandate. I can do that, or because that wasn't on the agenda, correct?
It wasn't specifically on the agenda. It was talked about, but
Okay.
we'll err to the side of transparency and let you talk.
Okay, so I've just kind of presented something I'd like to say. So as a hospitalist nurse practitioner, I've been caring for patients with COVID at both Mercy and Finley since the start of this pandemic. And we're currently seeing the highest hospital volume and death rates that we have since the pandemic began. Unfortunately, it doesn't seem statistics have moved this board to make changes, so I'm not going to go into the statistics because they're readily available online. But this is very serious. HIPAA laws severely impede the way healthcare providers can openly talk about what we're seeing. In addition, there's lots of nurses that aren't able to speak because their employers have certain restrictions on social media and what they can and can't say. So I think it's important not to take lack of providers speaking out as proof that we're not incredibly concerned about what we're seeing in the community, because we're very concerned. And I feel that if you're voting against the mandate because of enforcement issues, I think that's wrong. I think the first thing for our community to think about at this time is to slow the spread of the pandemic. And there's very few things we can do to do that, but we know that wearing a mask is one of them. So the questions that need to be asked and answered to make these decisions, I feel, are threefold. Number one, do the masks work? Number two, do they decrease the spread of the disease? And do they decrease the viral dose? And the answer is unequivocally yes. The science has been clear on this. And we have to listen to science and epidemiologists and infectious disease specialists. The experts are not the lay public. They are not politicians. They are not mayors, nor are they people professing civil liberties. When you take away all the background noise, we know that masks work. They're not perfect, they're not magical, but they do decrease the spread of COVID. And maybe more importantly, they decrease the viral dose. And what does a viral dose mean? It means that when you're exposed to COVID while wearing a mask, you're going to get a smaller viral dose, which equates to less serious illness and sometimes no illness at all. You as elected officials are tasked with doing what is best for your community. You are elected to make difficult decisions that might not be popular. You should not be making decisions based on the inability to enforce it. You should not be making decisions based on trivial sentiments that I've heard, such as you've seen more masking in places that don't require masks than places that do. That is hearsay and unscientific. That is speaking to emotions, not science. That is playing to your base, not doing what is right. The vast majority of citizens are good, law-abiding, caring people, and they will wear a mask if asked to do so. We can't not make rules based on a loud minority decrying civil liberties at the expense of protecting our most vulnerable. Frankly, I'm absolutely appalled that we're still having this conversation. Dave Baker was quoted in the TH on October 27th as saying, quote, "Nothing you have seen thus far makes you want to back the move now," end quote. To that I ask, what more do you need to see? Clearly, the frightening increase in cases and deaths have not been enough. Do you need to see the hospitals continuing to run at or near capacity? Or worse, Do you need to see them at capacity and forcing those of us caring for those patients, myself, to make excruciating, difficult decisions about who we provide care for? Do you need to see the death rate continue to rise? What exactly do you need to see to change your mind? Slowing the spread of this disease is perhaps the single most important decision you will ever make during your term. Even if it's difficult to enforce, even if it angers some of your supporters, it will help slow the spread because it will help the public realize how serious this is. And I cannot be more clear. The situation is very serious. Thank you.
Thank you for your comments. Okay. Any other comments on items not on the agenda?
Dave, you have Carol, who has indicated she'd like to speak in chat.
Okay, Carol. Is Carol unmuted?
Yep, now I am. Thanks,
Okay.
Dave.
Yeah, go ahead.
This is Carol Chesterman, and I'm not unfamiliar to you. I'm on here again today to ask for a mask mandate for Dubuque County so we can save lives. I certainly couldn't do anything better than what Lisa said, but I'm going to share some statistics with you. I've been chasing this elusive mask mandate back to August. I've been on board of supervisor meetings, board of health meetings, contacting individual board members. I've talked to you, Anne, a number of times. I've talked to you, Dave, a number of times. Every week, I come to these meetings armed with statistics, but somehow they seem to fall on deaf ears. Yesterday, when I wrote this, the death toll in Dubuque County was 59. This morning, I found out we have another 2 dead. So now we're up to 61 people. Thanks to the Telegraph Herald for giving accurate reporting so that we know what our 24-hour positivity rate is. It's hovered around 50% this last week. Today, it's 40%. We have over 1,700 Iowans are dead. In August, when I first started pursuing this elusive mask mandate, we were just nearing 1,000 people. We are reeling from one of the nation's worst COVID-19 outbreaks in the country. As was shown earlier, Patrice told us the White House, its own Corona task force, has repeatedly encouraged Iowa to implement a mask mandate. As a nurse, I have numerous nursing friends on Facebook. I've been watching them this last week, several of them posting, asking for prayers for them while they care for COVID patients because they're getting tired. As Lisa said, the upper leadership will not allow them to speak out and to get on this meeting to talk about their experiences. So they are sharing on Facebook. I asked one nurse specifically if I could share her exact comments, and she said that I could. And she wrote, as a nurse, pray for the nurses working the COVID wing at an unnamed Dubuque hospital. As Dr. Fauci said, it's going to get ugly, and believe me, it has. We need your prayers more than ever as we take care of your loved ones. Remember to wear a mask. Yesterday in Minneapolis, we had an ICU nurse who posted that they're out of ICU beds. And like she reminded the readers, not only are there no beds for COVID patients, but Dave, when you have a heart attack, there will be no bed for you. And when you have a stroke, no bed for you. When your son is in a critical car accident, there's going to be no bed for him. And practitioners like Lisa are going to have to make difficult decisions about who receives health care, what type of health care, and on what unit they get to go. And if you're in that emergency department, which is overflowing with patients, all the rooms are full, you're going to be sitting out in the hall on a cart waiting for a room in the hospital. And you're going to be exposed potentially to positive COVID patients who are have viral shedding and increasing your risk. So although you may say, well, we have beds, we have ventilators in Iowa, you need trained staff to care for these critically ill patients. There are only so many of these staff to go around. Nurses and doctors aren't like a piece of equipment that you order from your vendor. Quality care is a precious commodity and we have limited resources. We don't want to be into a position where we have to ration care like they're talking about now in Utah. Let's help our healthcare providers as well as our residents by slowing down the spread of COVID. I'm here again today to ask for a mask mandate for Dubuque County so we can save more lives. The longer we hold off, the bigger price we are going to pay in terms of human life. Thank you to the Board of Supervisors for your time.
Thank you, Carol.
You're welcome.
Okay, any other comments under public comments on items not on the agenda? I'll defer to Dawn Sherman to let me know if there's any.
There's
Other-
nobody raising hand and nobody has indicated their desire to speak in chat.
Okay, I would entertain, I believe our next meeting is our regularly scheduled meeting. So I would entertain a motion to adjourn.
So moved.
And I will second.
Motion made and seconded to adjourn. All in favor signify by saying aye.
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 Thank
Okay,
you,
motion
everyone.
carried 3-0, adjourned at 11:45 a.m.